Hello, everyone, and welcome to Being Well with Philadelphia Integrative Medicine, a virtual talk series during these changing times. I'm your moderator, Lance Isakov, and our topic tonight is Honor Self. For those of you who don't know, Philadelphia Integrative Medicine is run by a team of wonderful providers. Joining us tonight is Linda Sherlin, nurse practitioner, Zoe Phillips, physician assistant, and Dr. Georgia Tetlow, physician. Before I introduce Dr. Tetlow, I'm going to turn this over to Linda Sherland, and she's going to share a centering meditation with us. So Linda, they are all yours.
Thank you so much, Lance. Welcome, everyone. So glad you're here to join us tonight. I'd like to share a centering statement with you. I think these are special times right now. We are presented with a healing opportunity, time to join together and support each other. Slow down, breathe, communicate with loved ones, eat well, and move intentionally. Our stress bodies and our planet are healing. Philadelphia Integrative Medicine is ready to partner with you on your healing journey. PIM empowers, inspires change, and creates trust with patients, PIM providers, and staff, the functional medicine community, and ultimately the medical community at large. PIM integrates the best of conventional and complementary medicine to give the tools to be welcome. Tools to be well. I'm sorry. And now I'll give it back to you, Lance.
Thank you so much, Linda. I appreciate that. Let me take a moment to introduce the amazing Dr. Georgia Tetlow. Dr. Tetlow is a physician and mentor to clinicians. She is a board-certified integrative medicine practitioner, a clinical assistant professor of rehabilitation medicine at Sidney Kimmel Medical College at Thomas Jefferson University. She has completed a Bravewell Fellowship in Integrative Medicine at the Andrew Weil Center for Integrative Medicine. She is a certified practitioner through the Institute of Functional Medicine and founder of Philadelphia Integrative Medicine, which we call PIM for short. Last summer, PIM celebrated its 10-year anniversary of serving patients and our community. Dr. Tetlow is not only a leader in the medical community, she is the very heart of PIM. So without further ado, Dr. Tetlow, I'd like to pass the mic over to you.
Thank you, Lance. And thank you also for sharing that centering statement, Linda. And I think that PIM is intending to help us feel well and welcome. So that was right on. I want to acknowledge who's with us here tonight, and I appreciate you introducing us all, Lance. So I have my colleagues here today. These are my staff members. This is my team. We're also honoring Erin Orikar, who is our nutritionist, who's not with us tonight, but we're including her in spirit. I want to acknowledge that my healthcare providers have been working all day, and they are here tonight because we feel this is a really important topic to help create good decision-making information for you so that you can make the decisions that are right for you. So I also want to acknowledge Nicole, a staff member who is joining us as well. Thank you for being here, Nicole. My role right now is to lead a centering. We often do this we routinely do this as part of our presentations in the evening with community members. And it's also something that we do as a clinic, as a team, at least once a day, if not more. I hope that you'll join me in taking a few moments to bring yourself into this moment together with us, into this present moment, and into your body. One way to do that is to feel your feet on the floor. So if your feet are crossed, or if you can make an adjustment in your position so that your feet are touching the floor, and any adjustments in your position so that you feel supported and that your spine is long, feels extended and feels spacious. If you want to take a moment after your day and bring your attention inward, sometimes just lowering your gaze or closing your eyes can be a way to arrive. So I'm inviting you to come into this moment, into your body, and just to check in and see where you are tonight. Where is your body? How are you feeling? And just acknowledging yourself, including yourself in what you pay attention to. And I'll invite you to honor yourself, to honor your feelings, the messages from your body in this moment. And just to give yourself a little space, a pause. Allowing your breath and allowing yourself to just be. Creating as much safety for yourself. Safe to just pause, to not do something, to feel your body, to feel yourself. So we'll complete our centering meditation just by wiggling toes and fingers. And if you feel comfortable, you can make a gentle stretch. I want to welcome everyone here and appreciate that you're taking the time to join us tonight. We have taken a lot of time to prepare this topic tonight as a team. And we're looking forward to sharing this information with you and also to hearing from you in our question and answer. So welcome. Thanks for being here. Our topic tonight is safe and cared for now. Options for lab testing during the pandemic. And while we'll touch on COVID-19 testing, we're going to be focusing on routine and maintenance LabCorp testing and how that works and what that experience is like now as we're multiple weeks into the pandemic that we're in now. One of the things we hope for you tonight is that you can learn about options and learn about how to be as safe as possible when you're in the process of, if you have a lab requisition and you'd like to get your maintenance and routine labs completed, for us to talk to you about that experience and give you more. We're looking forward to being together, and next slide, please. Some of our intentions are carried over from our webinar series, so we've been with you every night for this last month. And we intend that you have the information and that you're well informed and well resourced. See, all the decisions that you make are ones that should be right for you, and you're deciding for yourself. As a patient of Philadelphia Integrative Medicine or as a potential patient, we are here for you. We're here for your questions and to support you. A few points we wanted to make to start off, and then we'll be sharing the webinar and guiding you tonight. Looking forward to hearing from you, as I said. We want to provide you with the information. And I think we've covered that you're in the driver's seat. One of the things we also wanted to say is that there's a term that's being shared a lot when we're talking about services that are available, services that are not available. So next slide, please. When we hear the term non-essential, non-essential refers to business categories, businesses that are essential or non-essential, and how that's defined by the state. We also want to explain and clarify that healthcare is not just essential healthcare and non-essential healthcare, but actually healthcare is, all of it is essential, all of it is important, because whether or not you're being treated for an acute condition or an ongoing condition, you matter. You have needs. And the information that we get from lab testing is invaluable. All of us were treating our patients today and receiving these labs, and also just being very grateful to have them in order to balance thyroid hormones, in order to look at adrenal function, in order to look at metabolic and kidney function, liver function, and the specific questions that we have. These lab tests are really invaluable to help us guide you. So what's most important is what is healthy and safe for you. So our focus is always to prevent illness and to care for you. So that includes helping you to manage these ongoing and quote unquote more chronic conditions. Next slide, please. One of the things we have learned while we did some research for you tonight, we looked into the resources that are available and what the experience is like when you go to LabCorp now, when you go to Quest now, when you go to your preferred outpatient lab test at this time, and also for specialty tests. At our clinic, we offer these specialty tests, which we'll describe a little bit later. We are learning that doing a comparison for these types of environments, whether or not it's an outpatient lab or a grocery store, there's actually a lot more intentional safety guidelines and measures that are in place in an outpatient lab compared to the grocery store. Some grocery stores are limiting the number of participants, but there's also a fair number of unknowns at the grocery store, which is just to say, if you are going to the grocery store, relatively speaking, it might actually be less risky and more safe to go to an outpatient lab that has the guidelines and that is maintaining those very carefully for your safety. As with anything that requires you to leave home at this time, we want you to know that we support any decision that you make. So there's risks with any time we get in the car or get in a plane. We hope to be able to get in a plane at some point and get back to our lives. So whatever we do, whether or not it's walk down the street or whether or not we're just staying at home, there's risks involved with everything. And so when you're not at home, there is a risk of COVID-19. But what we want to do is keep that to the absolute minimum and talk to you about that relative amount of risk in these situations. Here's a poll because we really want to hear what your experience is. We're going to be asking you some questions tonight, and we'd like you to start to check in and start to answer some of these questions so that we can serve you best. We'll ask you questions now, and we'll ask you questions also at the end of the webinar. And you can see what these are. So I actually won't necessarily read them. So Zoe, I'll take your lead on that because we're about to transition to sharing the facilitation of the webinar, and Zoe's going to come in. I wasn't actually going to read the questions. If you feel that that would be important just to identify what people are answering, we can do that. We can also just have some silence for people to be able to read and respond. We're inquiring whether or not you, what you're doing with lab testing now.
Thank you, Dr. Tetlow. We'll allow all of our panelists to and our attendees to continue to bring in your answers for our several questions here. I'll just take a moment and read them off and allow you to answer. So question number one, we're asking you if you went to Quest, LabCorp, or your preferred lab in March or April. We're also wanting to know if you did get your labs done. Was it a positive experience? We're wanting to know if you had a lab requisition and you chose not to get your labs done. What was the reason why? And we're also wanting to know if you're planning on going to the lab in the next few months. So continue to answer those questions, and we're going to be getting that feedback here very shortly.
So Zoe, it looks like we have about 50% who have voted. Would it be okay to end the poll at this point and show the results?
Yes. Excellent. So for question number one, it looks like 91% of you did not go to Quest, LabCorp, or your preferred lab in March or April. For those of you who did get their labs done, so 9%, the majority, 73%, did not have a positive experience. For those who had a lab requisition and chose not to, the most popular response was that they didn't feel safe. That's 64%. And for question number 4, it looks like 64% are planning on getting labs in the next few months. So thank you for taking the time to answer those polling questions. Next slide, please. So we wanted to just briefly go over some of the common symptoms for COVID-19 that may prompt you to get a PCR test to determine if you have actively COVID-19. So the CDC had originally outlined the symptoms of fever, cough, and shortness of breath. But as of yesterday, the CDC also added to that list of symptoms shaking, chills, muscle pain, headache, sore throat, and also new loss of taste or smell. So we wanted to provide you with this update because we are still getting questions from our patients about COVID-19 testing for active COVID-19. Next slide, please. So for this testing criteria, we still want to remind you that in order to get this testing, you do need to exhibit COVID-19 symptoms. Some of the symptoms that I just listed on the last slide. And you also need to have known exposure to someone with COVID-19. If you're wondering if you should be tested, we do encourage you to call your primary care provider, or you could also contact your local health department. And you can use the website below to help find a testing site. Now, we are excited to share with you some updates that we've gotten from LabCorp, which is one of our main lab sites that we use with our patients. Many of our patients are able to go to LabCorp, which is covered by insurance. So many of our patients are wondering what the updates are. How safe is it to get labs drawn? And these are some of the new updates. So LabCorp is putting in place a first business hour rule that is set aside for those who are more vulnerable. So 65 years or older, or those with underlying medical conditions. There's also a new program that's called Wait Where You're Comfortable that allows patients to wait in their car or a safe place until it is their turn to have their labs drawn. And this limits the amount of people to come in contact with as you're getting your labs. There's also some mobile check-in availabilities. So again, you can limit the amount of people you're coming in contact with, and that way you have a scheduled appointment time. They are taking more precautions for increasing their sanitation and disinfection, and they're requiring that for individuals to have contacted their healthcare provider to get COVID-19 testing. And this is important, so this will help to cut down on the amount of people who are coming in looking to get testing on their own. So these are some exciting new updates that we are happy to report. Next slide, please. Similarly, Quest is putting in place a lot of great new precautions. They are also putting in place a wait by text program, so that way you can wait before you get your labs drawn. They also have a first business hour set aside for those 60 plus pregnant or again, underlying medical conditions. They're practicing social distancing for those who are in the office, and they're making a point to require those entering their facilities to wear face masks. Staff are using gloves and hand sanitizer, which is provided at check-in. And for some locations, there is a greeter who is using a no contact technique to actually take your temperature when you walk in. And so you will also notice staff members using protective equipment as well, and they're doing more to up their cleaning schedule. So we are excited about these updates and feel pretty confident in the safety that is being put in place by our two most frequent lab clinics. Now, some of our patients do also use additional labs. And so we also, some patients use, go to other labs other than Quest or LabCorp for specialty testing, such as Exam 1 or any lab test now. So before going to these labs to get your labs done, if you so choose, you want to make sure to call and ask if they're even open. Some labs have closed. And you want to make sure to always make an appointment in advance. Now, this is not typically our recommendation. In months past, patients can certainly go in and they don't need an appointment time, but we do encourage that in this season. This is something that I'd like to spend a little bit of time talking about. We have many patients who are very much interested in the COVID-19 IgG antibody test. And we had talked about this on previous webinars, but it's still very important for us to communicate to you that there is still so much we do not know about COVID-19 and also about the antibody test. Now, the antibody test is available, but if you choose to get this done, just because it comes back positive, this does not promise immunity. And it may mean that you are able to give plasma to help others. However, there are some other caveats to this test. The antibody test may take up to 3 weeks to be positive, about 15 to 21 days. Antibody testing does not assess for current action. We also don't know if 100% of people make antibodies. And there's no antibody test that currently exists that has cross-reactivity testing to make sure that it does not become positive due to the other 4 common cold coronavirus. Next slide, please. And at this point, I'd love to turn it over to Linda, who's going to tell you a little bit about what we do and our testing.
Thank you so much, Zoe. You know, when you go to get labs and come to Philadelphia Integrative Medicines, you might notice that we interpret things a little bit differently. Have patients say, well, you know, I've always been told that was okay. Vitamin D of 20 is okay. And we're trained in interpreting routine labs from an integrative and functional medicine perspective. So you might see a different range that we're recommending in your lab. So sometimes looking at them and you'll say, well, everything looks normal. Why do I need an appointment? Why do we need to talk about this? And I think it's always very important to talk about what that lab testing means in general from an integrative and functional medicine perspective. Also, what does that result mean for you? And so tracking things, and as we have interventions, so maybe you have changed how you're eating, you've stopped sugar. And so we want to track and see what is happening to make sure that you're meeting the goals and having your best health. We're always working towards prevention, healing and prevention. And so it's important, is everything we do is very individualized, that we have goals that are set for you. And not that just, well, there were no abnormals on my lab, I'm fine. And that's not always the case from the perspective we look at. You know, the other question that's come up often during this time, because there are many folks that are not ready to go out to the lab. And so it's like, oh, I don't think I want an appointment. I don't have lab work. And I think that's something that happens, is we always believe we must have data and more data. And something that's very important to remember, that the body that we live in has data. It provides information. And so we have numbers, and those are great, and those give us information. But sometimes I think the thing that we forget is that we can trust this body to tell. And so sometimes having that relationship with your provider and collaborating to notice things that are different. I think a lot of times in our culture, in conventional medicine, we've learned to live outside of our bodies and wait for someone else to tell us what's happening. Oh, your pain can't be that bad. Surely you don't have a headache every day. You mean your stomach still hurts? Well, we can't find anything wrong. And that's the important part with functional and integrative medicine. When we're looking at root causes, we really want to listen to the body and to know that even though there is a whole world of specialty testing, that listening to your own body and noticing is very important. And that's something we spend time talking with. So whether you have lab results or you don't, it doesn't mean that you can greatly benefit from having an appointment with your integrative or functional medicine provider. So I'd like to talk a little bit about some of the specialty testing we do. Now, the tests that you see listed here do not require you to go to a lab at all. And so there are a lot of things that we can assess and determine without having to go to the lab. One of our favorite tests is a GI map. That's a stool test. It looks at many things in our digestive system, the microbiome. It looks at our normal flora, what we expect to see there, what gives us best health. It can also look for viruses and different sorts of toxins, worms. And it tells us if there are some bacteria in our gut that's not always supportive. It may not be causing a problem, but it could. We kind of call those guys bad actors. And normally if the flora is healthy and that normal flora is very healthy, it takes care of the bad actors. Sometimes though, we need a little bit of support. So it also talks to us and speaks about your intestinal health in general. Do you have inflammation? Are you absorbing your fats? Do you have enough digestive enzymes to digest food? So there are many things that we can learn from this stool test. Really in the gut, we see such a connection between the gut and the brain, the gut and inflammation related to autoimmune disorders. So there is so much information that we receive from this stool test, and we're learning more and more about the importance of the gut and our function and our general well-being and health. A Dutch hormone test is another beautiful test that, again, you do not have to go to a lab. These tests are sent to your home. It comes with a FedEx label. You put the label on and you send it right back. And then we receive the results in our office. The lovely thing that I think is really important, when I read the centering statement, as I wrote that statement, I do think that even though this is a time of stress, it's also a time for us to really be healing our hypothalamic pituitary adrenal axis, that fight or flight versus our parasympathetic nervous system, our rest, digest, that calm. So one of the key factors with the Dutch hormone test, it looks at that HPA axis so that we can have a lot of information. Also, it's important that we're always going to protect ourselves. Our body is going to protect itself. We're not going to be able to make sex hormones if we're too depleted and we don't have our adrenal hormones. So the Dutch test looks at all of those relationships. We're able to see if there are inflammatory estrogens, inflammatory androgens, hormones that maybe are not being metabolized out and excreted as they should be. And those put us at risk for some of the hormone-based cancers. Beautiful test. A Marcon's nasal swab, another wonderful test. We can see if there's resistant bacteria, resistant fungus growing in the nasal passages. Some people have recurrent sinus infections, or there's always kind of a drip and just think, oh, it's just my allergies. With the Marcon's nasal swab, we can see if there is resistant bacteria and address that. Organic acids test gives us so much information about gut microbiome. It tells us about neurotransmitters, toxicity, how well is our body detoxing. Many uses for this test. It gives us a lot of very overarching information to provide healing and opportunities for healing. Heavy metals testing, if there have been any exposures. Again, a test that can just be sent off. SIBO, small intestinal bacterial overgrowth. Somewhat of a topic now, people that have just had gut issues for a long time. Ugh, every time I eat, I bloat. I don't know what's wrong. My stomach just poofs up. And so that's one of the tests that we do. It's actually a breath test that's sent to you. You send it off, and then we're able to create a treatment plan for you. Mycotoxin urine test, that's looking for mold exposures. Maybe you're concerned that you have mold in your home or you work in a moldy building. Mycotoxin, it's a simple urine test that can address, that we can have an understanding about what's going on. So there are a lot of wonderful ways to support our health without ever having to go out to the lab. And it's really been great to, I think, have these tests. And so that those might be things, if you have questions about those, feel free, please, to call. We have 20-minute consults that are free. You could give a call and schedule one of those, and we'd be happy to talk with you more about your health concerns and what could possibly be a fit. In that 20-minute consult, we're not going to go into what test is right for you. We can't determine it, but we can certainly answer questions for you. Lance, could I have the next slide, please? So kind of, I actually just got into that, who we are and what we do. We do have an integrative and functional medicine approach. Now, we also are conventionally trained. So, you know, I come out of a family practice background. So not only do I have these special tests, but if there are other health issues going on, those are also things that we've been educated and trained to think about, to address, to treat. We're not primary care. We ask that you have a primary care practitioner to cover any sorts of emergencies. But we do have that background. But when we look at integrative and functional medicine, it's just as I said, that specialty education around testing, around interpretation of testing, also bringing lifestyle, thinking about other modalities, acupuncture, massage, mind-body work. There are so many. This is a complex body that we have, and it's not just this physical part. And so when we look at integrative medicine, it's about bringing those things together. Not only do we do that, but also we have the referral sources to help you find the right practitioner for some of these other modalities that we feel are really crucial to your health. We treat all forms of chronic illness, as I mentioned, autoimmune illnesses, gut health. If you're new to PIM, I just mentioned our free consultation, and you can schedule that online or you can call. We have a newsletter. We'd love to have you go to our website, philly-im.com. That's PHILLY-IM is in integrative medicine.com. You can register for our newsletter. If you do come, there's information on our website about billing, about charges, about reimbursement, but you are eligible for a super bill to be submitted to your insurance for reimbursement in the state of Pennsylvania. You can also, you must be in the state of Pennsylvania to be able to qualify for a super bill. Medicare patients, cannot submit super bills, but anyone else could. Also, we have access, and the laws have changed and lifted around telemedicine. So we have special codes that we add to your invoice that you receive that says that you've had a telemedicine appointment, and insurances are covering these now. And so just know that if it's a telemedicine visit, it's not anything you need to worry about. That's how your invoice will be coded, and it'll be ready for the insurance company. So a little summary tonight about non-urgent and routine lab work is that LabCorp and Quest and preferred labs do have excellent safety practices in place. I've gotten great feedback from my patients that have gone to the lab. I saw someone yesterday, I saw someone today. Their particular site was open, they called ahead, they scheduled their appointment, they were taken in right away. One patient yesterday even told me that she had an easier time scheduling because the labs are not as full. We do know that some labs are closed and not seeing folks. So again, please call or go online and schedule that appointment. We want you to be informed to make your best and safest health decision for you. Some people have been going to the grocery store, they've been going out, doing things, and they're like, I'm ready to go get my labs. And that's great. Others are saying, you know, I have been sheltering in place. I don't know, just like we said, we don't know so much about this virus. I'm not ready for that yet. All of those are great answers. You know, you have your own inner healer. Check in. See what you feel like is right for you. You're the center of your care, not your labs, not your numbers. It's all about you. And so we, you know, feel like those things are very important. Again, always call if you're a Philadelphia Integrative Medicine patient and you have a question, reach out, send a portal message to your provider, and we'd be happy to talk with you about that and help you discern what's best for you. That's very important to us. We work with you as a team, collaborative. As you can hear, we've, you know, have data that's just coming in daily, and we're looking at that. We're meeting together as a team to bring you the most up-to-date information that we have available to us. Now, after hearing this information, we'd love to kind of check out a poll again and see, there are just 2 questions here, if you have any new thoughts once we've had this chance to visit a little bit tonight. So Lance, whenever you're ready, you could put up the second poll. It's 2 simple questions. Are you planning on going to the lab in the next few months? And do you feel more safe after being in this webinar? We're going to give you a few minutes to just answer this. I see that some of you are already asking questions, giving us comments. That's wonderful. At the bottom of your screen, you'll see the Q&A button. Please enter your questions. We really wanted this to be interactive tonight and for you to have a chance to share your questions, maybe concerns that we could address. All right, it looks like we have our answers up. Are you planning on getting labs? It's kind of split, 56 yes, 44 no. And do you feel more safe after coming to the webinar? That's 81% feel safer. That's wonderful news. That is what we had hoped. And again, as I said, please make sure that you honor what's right for you and reach out if we can be of any help or support. And now I'd like to turn this back over to Zoe. She's going to talk to you about an exciting opportunity and an offering that we're going to have coming up very soon.
Thank you so much, Linda. So yes, I just wanted to talk to you all about our next webinar that we're so excited to host. It's going to be on May 20th from 7:30 to 9, another Zoom webinar. And this talk will be about estrogen dominance. So in this webinar, I hope that you'll take away an understanding of sex hormones in general. What is estrogen? What is progesterone? What is testosterone? And what would estrogen dominant symptoms look like in both men and women? What risks does this pose? What do I do to diagnose this? What do I do to treat this? And what do I do to achieve good hormonal balance in general? So I know this will be a very enriching night. And again, I'm really looking forward to seeing you there. So at this point, I'll turn it over to Dr. Tetlow, who's going to talk a little bit about our call to action and also speak to some question and answers.
Thank you so much, Zoe. And also thank you to my team, Linda and Zoe as well. I always enjoy hearing the sharing and the presentation styles and the emphasis from my team. I feel really good about my team, and you know, I had a full schedule today, and it's really my pleasure to hear from my colleagues. I also am so heartened to be reminded that we're listening to our bodies, and we're listening to ourselves and what's right for us, and that's what we want to assist you to do every day and tonight. So we have a few items where I can explain. There's some invitations, some calls to action. So I also want to say we are going to have plenty of time to address some of the questions that are appearing right now in the chat, actually in the Q&A section down at the bottom of your screen. So as we're going through some of these final items and we're winding up the presentation part of the evening, please think about the things that matter to you, the things that would, you know, that have come to mind and that would also potentially make you feel safer if you were to know some of those things. There's a few of you that had some great questions, and we're looking forward to answering those. So we also wanted to acknowledge that one of the ways that we stay healthy as a practice is we are very much supported when you share how you've benefited yourself from being treated and served by Philadelphia Integrative Medicine. So your support of our practice is something that we really appreciate and that we're very grateful for, and we don't take lightly. We are here to serve you, and we work very hard to do that. So we've been talking about lab ranges and how we interpret and inform our interpretation of Quest Lab Tour and other testing in different and sophisticated ways to serve you. Sometimes people are coming to our clinic saying, my labs look fine, and everyone's telling me, and my medical team shares that I am fine, but I actually do not feel well. And that's where an integrative approach to interpretation of labs can really make the difference in helping you to feel better. We'd appreciate if you can share PIM with your loved ones. We want you to do that, and we're encouraging that type of sharing. And you've heard about free consultations from my colleague, Linda. And I also love free consultations, and I've always enjoyed. There's certain things that I really look forward to in the practice. And I actually am not doing free consultations right now, but you better be careful because I might be coming back. There's certain things in my week that I really love. We'd also like to encourage you to go to our homepage on the website. We have a button that says COVID-19 Safety and Resources. And if you click on that teal button, it's opening up to lots of things that we're updating over time. So these are mind-body resources, information resources, and some of these pages open up to just a whole world of things that can support you right now. Whether or not it's information and answers to questions that you have, or whether or not it's ways to cope and ways to support yourself, ways to be informed, we want to offer all the free resources that we can for you. We also do a newsletter, which is something that we offer every 2 weeks, and we try and give you meaningful, reassuring, encouraging, and inspiring content so that you also feel our intention, which is that we want you to be well. We want to help you, and we want to reach out to do that. So we have a healing message that we share every 2 weeks. And then we have just a little reminder email that comes out on the off weeks with just information about our many programs that we're ongoingly developing to be of service to you. I do want to mention that if you are a healthcare worker, or if you are an integrative professional, which could be a massage therapist, it could be a physical therapist, it could be someone who works in energy medicine, it could be any type of integrative professional, psychology, and also all categories of healthcare workers, all specialties. We are hosting a virtual lunch, and we've hosted many of these ongoingly in the past over the years, and we've had you in person, but now we have a virtual lunch. And we've had one of these, very successful one in April. And we got a tremendous amount of thank yous and good feedback from the community, supporting each other, understanding who has gone virtual, who needs assistance to go virtual, and helping those people as best we can with their livelihoods, and also what things can lend themselves to a virtual offering so that some can continue in their practice in these different modalities. Our next one is going to be at lunchtime on Wednesday, May 13th. And so please help us spread the word to support our community. There is one final offering that wasn't listed there that I get to introduce to you personally, and that is the monthly offering that I have been hosting for the last 5 or 6 years. That is a self-care experience for people who are also healthcare workers or integrative professionals. That's not just a networking experience like the virtual lunch. It's actually a self-care experience. It's a guided experience where there's time for sharing and discussion and mutual support. So that's something that is now really, it's always been a great joy for me. So you're also very welcome as a healthcare worker and integrated professional to join me. The next one is this Monday, 8 o'clock in the morning. And that will be facilitated by our clinic manager, Michelle. She'll be there running the Zoom. And so we'll be there, and we hope that you can be with us at 8 o'clock this Monday, the 4th of May. I'd like to wrap up the formal presentation and actually transition to questions. So I'll be asking my team members to assist, and we've got plenty to talk about. And let's make a transition to facilitating the Q&A.
So it looks like we have
Great,
several
Linda.
questions here.
Okay, we can hear you. Thanks, Linda.
Okay. I said it looks like we have several questions tonight. And comments as well. Thanks so much for the comments. Daniela had a comment on our poll, and we'll look into that. Not sure about that. We're learning and loving polls, but it's always a new experience, so we appreciate your feedback. Kelly has commented that Quest seems to have about 75% of their offices closed, and she is concerned about concentration of so many people to the few offices remaining.
Georgia, did you want to speak to that?
I certainly could, and anyone else who'd like to respond. So Kelly, thanks for that observation. You're doing your research just as we're inviting you to do. You're making calls and you're seeing where you can go to get your lab testing done so you can arrange that in advance. What I'm hearing you noticing is that many of the offices that you were expecting to be able to visit are closed. So now you have this concern about what it's going to be like if I go there. Is it going to be an overwhelming number of people? Is it going to be safe? And what I would share with you is that Quest is observing the guidelines for social distancing. And also because there's these options that have to do with waiting safely outside the facility and being called on when the lab techs are ready to take you in safely with a certain number of people inside and not an overwhelming number. I do feel that that particular point, I feel confident that you would be safe and there wouldn't be an overwhelming number of people, so many people that it would be scary or that it would be unsafe for you. So I think that's what I would share about that.
And I would say that the 2 patients that I mentioned yesterday and today both had gone to Quest facilities. They weren't crowded, they were in, they were out. So that was the feedback, personal feedback from some of my patients that have actually gone.
It looks like we have another question from a patient, Daniela, who wants to know if we can specify which specific labs we can get, what our specific labs are for MARCONS, SIBO test, and mycotoxin urine test. So for these tests, we use Vibrant Wellness for mycotoxin, Aerodiagnostics for SIBO, and Microbiology DX, which stands for diagnosis, for our MARCONS nasal swab.
We've got another question, which is from Anonymous, about is taking temps a good indicator for letting people into testing facilities or stores. And this is something that many workplaces are actually required to do right now, is to take people's temperature. So taking people's temperature is a safety measure. And so it's going to tell you through the, whether or not someone actually has a temperature or fever. But as we know, and you might already be aware, that there is an asymptomatic period before people are expressing symptoms. And the median period of time for that asymptomatic period is 5 days. And there are people who have a shorter period of time and they show symptoms sooner. And there's folks who actually take longer than 5 days to show symptoms. So they might actually have the virus, but not actually know it themselves, and might not be knowingly exposing anyone, but just really not have an idea. And so if you're just taking temperature, you're doing a screening measure. So you're increasing the likelihood that you're going to catch someone who's symptomatic, who has a fever. And of course, if you have a fever, it doesn't mean you have coronavirus. It means that you have a fever, and you can have so many reasons why we get a fever. There's different common cold viruses, other coronaviruses that we've been experiencing for years. There's actually 4 of those. There's different types of influenza viruses. There's many types of infections. There's also a lot of metabolic concerns that are going to cause us to have fevers. So it's an indicator. It's a screening measure, and it's not perfect. So it's not going to catch someone who doesn't have symptoms, but it is actually required by law in many workplaces right now in our state for that to be in place. And there's many countries that have instituted that, even related to public transportation, to allow someone to enter a train, for example. That's been instituted months ago in certain countries in South Asia, not actually allowed to go on public transport. And those are cities that rely on public transport, where we're a little bit different in our cities in terms of our reliance on that public transportation. So thanks for asking that.
So John's asked if this webinar will be viewable on our website. Thanks for asking that, John. Absolutely. It will be up tomorrow. And so anyone, you go to the website and you register, and then you have access to this webinar.
Looks like we have a couple of questions, and one of them's a little bit longer, so I'm going to take a little time to read that. If anyone wants to answer a shorter question, or I'll take a look also down here.
Allison has a question. Are you more at risk for COVID-19 if you have latent TB, tested positive for tuberculosis as a child, have not had TB, and took the recommended medicine rifampicin? That would be a great question, Dr. Tetlow.
Okay, so rifampicin is, we're familiar with that, prescription medicine. So you're asking about your particular situation. Am I more susceptible? Am I in that high risk category? Am I one of those people that has a comorbidity where that would put me into a different risk group, risk stratification? So that's an overall question that has to do with how robust your health is at baseline. It's much more about your medical history. So this particular question is, that's a good question. So you're describing having had a diagnosis when you were younger and having taken a medication, but actually we have some question marks there. So we actually don't know what your status is now. And I wouldn't automatically put you into a high risk category based on that information. I would want to actually have more data to help you. And that's where actually some of this lab testing that we're talking about could really come in handy. So I would not, based on what you've shared here, actually put you into that category. And if you are a patient of Philadelphia Integrative Medicine and you've got a question like this, and we know your history and we've worked with you closely, we've done your physical exam, and we've recommended treatments for you, you are our patient. And if you've got questions about, am I at increased risk? Do I need to be worried? Am I okay? Is there anything else I should be doing? Please reach out to us. We're hearing from our patients every day. A big part of our day is responding to the patients we see on telemedicine, because we're 100% virtual, but it's also caring for our patients who are asking questions between appointments about their treatment plan. Thanks for that question. So I haven't had a chance to read this completely, but I might need some assistance from my team just to be able to understand this question. This is actually a little bit of a longer question from Anonymous, but it has to do with someone who potentially be coming into the home who mentioned that he might not be feeling well.
So I think this might be a great thing to think about. I just like to read it, Dr. Tetlow, if that's okay, because
Yeah.
it may apply other people, you know, it may fit your situation. It says, I need to replace my hot water heater urgently. And the contractor who is supposed to come Friday mentioned he didn't pick up my call yesterday because he wasn't feeling well. I asked him if he may be experiencing coronavirus symptoms, and he said he only has a headache, which isn't a COVID-19 symptom, but we had some new symptoms tonight. Should I let him come in my home Friday to install the water heater? I'm not sure I can find someone else last minute, and yet I'd hate to risk potential COVID-19 exposure. Would it be appropriate to ask to measure his temperature before he does the job? He and I will wear a mask, but even so, what is my risk here if he does the install? After he leaves, should I clean the utility closet and bathroom where he will work, or just close the door and quarantine the room and air there for a few days?
Mm-hmm. So I want to appreciate that we're challenged by these questions all the time, right? We might have a family member who is dealing with an issue, and so we're trying to figure out how to handle it in the most safe way possible. And I realize that there's anxiety about this, and I appreciate you reaching out to ask. So in this situation, you're in a relationship or potential relationship with someone who is a service person who might be coming to your home to provide a service. So in this case, I would explore that relationship. You can always ask someone if it's okay for them to let you know what their temperature is or to take their temperature, but they may or may not say yes to that. And if they do or don't have a fever, then it doesn't necessarily mean that they could be that asymptomatic period. And so you mentioned that he wasn't feeling well. So now you're really thinking about this. Should I let this person in? So what you're doing, and what we're all doing, is we're weighing what we're comfortable with. And this is really good to talk about out loud. So we don't actually have you here to counsel you and to discuss, but this is something that we really benefit from sharing the pieces that are important. This is why I need the hot water heater, and this is why I need it urgently. And what would happen if I waited a couple of days and I found some, other options? I had a choice between who's coming into my home. What does that mean for me? What does that mean for my family? I would say one way we can answer this question is, how could you make it as safe as possible? If you're having someone come into your home, whether or not it's because you have an electrical issue, you have some type of service that's required, and you're having someone come into your home and you've chosen to let that happen, what are some ways to make that as safe as possible for you? So one thing is to have a discussion with the person coming in about things that are important to you and that you want to see happen. And another thing is to make sure the windows are open. So one thing that we know about the COVID-19 virus is that if you are in a room inside and your window is open, those respiratory particles, if anyone's breathing, right, everyone have a mask on, but those particles, they just go right out the window. And there's great visual data on this, and it's very reassuring to know. We do this with people who live in a toxic environment. They have mold and they can't move out. They are sitting next to an open window. And this is something, that open window is really helpful. Of course, if someone's coming into your home, you do want to clean and wipe down any surfaces that they touched. And also, you do want to keep that 6 feet distance from that person, as I'm sure you know. But also understanding surfaces and how long this virus lasts. So plastic and stainless steel, there is data that said it lasts for 4 days, but it can actually last for 7 days. So let's say you are wiping down the outside of that closet. There might be some things inside that closet, and the hot water heater is replaced. You close that door and you don't open it for a week, right? That hot water heater is installed, it's doing its job. You can have a hot bath or shower again, and you don't have to worry. So I think this is a judgment call, and also the urgency of it. If you feel more comfortable to have an option of who you're inviting in your home, so you can talk to them and see who you're comfortable with, and you have a couple of days where you don't have hot water, you have to decide if that's going to work for you. But I do think there's ways to make this more and more safe, and it's good to talk it out, discuss it with your family, and work on it together. Have a game plan, and at every step, see if you feel comfortable.
Our last question from an anonymous attendee says, does the BCG vaccination administered years ago protect me at least partially from COVID-19 now?
So I would say the answer to that is no. A past vaccination does not protect you from COVID-19, whether or not that's a flu vaccine, a pneumonia vaccine, in this case is a BCG vaccine. So that is not going to protect you, because what a vaccine is to a very particular type of antigen. So the coronavirus is a new virus that has never been encountered before. We are learning about it, and we're understanding it better, and we're responding to it better, and we're coming up with solutions to it more and more every day to create more and more safety for ourselves. But this is actually an RNA virus, so it's not made of DNA, it's made of something that's a precursor, an RNA. It's actually a really large genome, and we've never actually had an RNA virus that was this big before. This is new. So if you've had a past vaccine, you don't have protection to this virus. And one of the things that we're working on is there's different parts of the virus that we are, making sure that a vaccine that we're in the process of formulating and creating, it's going to be to these different parts of the virus. There's an envelope protein membrane. There's all these pieces to it. There's spikes on the virus, and we want to make sure that the virus is effective. And there's actually some wonderful news that Jenner University in Oxford, Jenner Institute at Oxford University is already beginning the process of getting in place some clinical trials where they're done a beautiful job developing a vaccine option for us to see whether or not it is safe and effective in a much shorter period of time than we anticipated. So that's something to look for in the news, and that's being discussed every day. So we don't have that now. We cannot promise when we have that. And we're going to see about its efficacy and safety. And that is, we're fully engaging.
We have one last question. We're a few minutes past 9, but this question just popped up. What can you share about some reports that COVID-19 exhibits dermatological symptoms too?
So we don't have a lot of information about how COVID-19 expresses itself on the skin. We don't have a lot of information on that. We do know that it is a virus that is going through your whole body. So your skin is involved. If you have the virus, then your skin is part of that because it's part of all of you. And your whole system is working to respond and to create an appropriate immune response to create the recovery and safety for you, so you move through it well. So I think it would be a great time for us to complete our webinar tonight. I want to thank our host. I want to thank our colleague, our staff member, Nicole, who has joined us quietly tonight, but was present throughout the whole thing. I want to really thank Linda and Zoe for their leadership in developing the content of this webinar. And we also feel really good about the second poll that we heard from you, that you feel safer about your options for doing your outpatient lab testing. And that was our intention, and we feel good about that follow through. So it takes a lot of energy for my staff. I really appreciate them being here tonight with you. And I also want to thank you for taking the time for us to be together. And we are here for you. We'd love to see you at our next online events, which you've heard a little bit about. It's the events section on our website. Thank you so much for being here. We hope that you are well and you have a very pleasant night. Take care.